You're listening to Monday Science Podcast, the show that brings you the latest in science, technology, and health with your host, me, Dr. Bahija Raimi Abraham. Hello and welcome back to Monday Science. Happy Monday, and I hope you're having a great start to the week. So our Monday Science Person of the Week goes to Dacia Taylor, who is a 17-year-old Iowa high school student. And she invented or has invented a cost-effective way to detect infections in surgical patients. And so Dacia developed this color-changing sutures using beets. I know Americans say beets. I think that's beetroot. Yes, aimed to detect infections in surgery. And what she learned was that the color of beetroot juice would change from red to dark purple if a surgical wound was infected. And so this is a best indicator of infection by noting the change in a patient's pH levels. And so the average pH apparently of healthy skin is around 5, but when a wound gets infected, it goes up to about 9. And so Dacia developed an interest in infections that developed after cesarean section, specifically, she's specifically interested in those in impoverished nations where women experience high rates of C-section infections. And amazingly, Dacia Taylor is one of 300 students in America to be named a Regeneron Science Talent Scholar. I'm always so amazed by kids, I guess, or high school kids that are able to come up with such levels of ingenuity and innovation for health. One of my favorite TED Talks many years ago was a TED Talk by a boy who was 16 years old called Jack Andraka. It's one of it's like 4 million views. It's one of the most watched TED Talks. And he developed a pancreatic cancer test. And it's really interesting just when you listen to these kids and their innovation and why they get so passionate about health and medicine and science so early on. So well done to Dacia, but also do see if you can get hold of the TED Talk. It's a really good TED Talk. On to the news for today. So a saliva test has been developed that could diagnose concussions. So a concussion is a type of traumatic brain injury that can be caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and the brain to move rapidly back and forth. And so there's several people in the world globally that sustain sports and recreation related concussions each year. But diagnoses of these brain injuries still remain a challenge. And there are various different sports. So, I mean, in the UK, rugby, I mean, to be honest, a lot of sports, there's a big issue around the risk of concussion per year. But researchers published a study describing a saliva-based test that accurately detected concussions in male rugby players in the British Journal of Sports Medicine. The test measures expression levels of 14 small non-coding RNAs in saliva, including microRNAs, which are indicative of brain injury. However, research has shown that there are sex-related differences in concussion, meaning that this test will have to be studied on women before it can be used in the general population. But at least that's giving some hope. Quite a few films actually that have talked about concussion. So in 2015, there's a film called Concussion. And it's an American biographical sports drama which starred Will Smith as Bennett Omalu, who was a forensic pathologist who fights against the National Football League, who are trying to put a stop and suppress his research. And he was looking into brain degeneration suffered by professional football players. And it's a very interesting film, and it's just it's based on a true story. And the work that he did, so it's very interesting. It was related to American football related head traumas in patients. Okay, so on to today's episode. In today's episode, I'm talking about single women's fertility and egg freezing with Dr. Zainab Gurtin, who is a lecturer in women's health at the Institute for Women's Health at the University College London, so that's UCL. And she also holds an affiliate lectureship at the University of Cambridge Sociology Department. This is actually a two-part episode. So as I mentioned, in this episode, we're going to be talking about single women's fertility and egg freezing. And then next week is going to be the concluding episode where we're going to talk about motherhood over 35 and motherhood over 40, particularly miscarriages and the impact of COVID-19 on fertility.
Perfect. Thank you so much. Welcome back to today's episode. We have a very special guest today. We have Dr. Zeynep Gurtin. How are you today?
I'm great, thank you. How are you?
I am very good. I'm very excited, as I just even said before, I'm very excited to have you on the episode for many reasons. And I'm just really grateful for you to be here. So thank you so much for your time. Whilst we get into it, do you mind just telling
Thank
us?
you for having me.
That's good. Do you mind just telling us a little bit about yourself?
Yes, sure. So, as you said, my name is Zeynep Gurtin. I am a lecturer in women's health at University College London's Institute for Women's Health. And I am a reproductive sociologist, which is probably something many people have not heard of. But what that means is that I'm a sociologist who specializes in issues around fertility and reproduction.
Amazing. And so I changed the format of the podcast this year to ask some questions because for me, as we know, we are in a pandemic, and I found that a lot of people have spent a lot of time listening to music, watching films, reading books. So could you let us know your favorite song at the moment?
Oh, you know what? I'm terrible with music. I don't really tend to keep up to date. But today I've been walking my dog, and it was beautiful and sunny. So I was listening to Gracias a la Vida, the Joan Baez version, and it was just, yeah, it felt like the perfect thing to be listening to today.
It has been a beautiful day. And what about films or books or?
Books, I have a great book recommendation. I just read a beautiful little book last week called How to Be a Good Creature. And it is a book by a woman called Sy Montgomery, who writes a lot of books about animals. She wrote a very famous one about the soul of the octopus a couple of years ago, which most people have heard of.
Oh my gosh, that
but
sounds
this
really
book is excellent. Yeah, in this book she goes through sort of 13 animals that she's sort of befriended or that have been her pets and what lessons each has taught her. But a beautiful little book, so that's a gem of a recommendation.
Thank you very much. That's a very interesting one. And I'd also be interested in the octopus book. Does she have a pet octopus?
No, she didn't have a pet octopus, but she sort of I think she lives in San Francisco or near somewhere around there. And she became very sort of good friends with an octopus in the marine center near there and learned all about them. And apparently they're incredibly intelligent creatures. And they really pick and choose which humans they interact with. So they really show you whether they like you or not. But yeah.
That's so interesting. I know, I mean, the only sort of, I guess, time that I really got to see an octopus, aside from, in the aquarium, but actually, there's an octopus they usually bring out for World Cup, or is it the Euro Cup? I think it's World Cup, that was very good at predicting who was going to win.
Yeah, I remember. I remember there was that. Yeah.
There's a bit of a random point of reference, but thank you so much for those recommendations. So you mentioned your research. Do you mind just going maybe a little bit deeper into what you do and your work?
Yeah. So at the moment, we're living through a really interesting time sociologically in terms of the huge shifts and changes we're seeing with regards to how people create their families. And my research really focuses on some of the questions around that. In particular, I explore the feelings and experiences of people who engage with what we call high-tech reproduction. So couples who've gone through IVF, or women who are using donor sperm to become solo mothers, women who are freezing their eggs. So that kind of really high-tech end of reproduction, which people end up going to or resorting to for a multitude of different reasons. So I work with, I explore the experiences of those people in a kind of a qualitative way. And recently I've also been doing a bit of work around motherhood, sort of later motherhood, especially motherhood after 40, which is a hugely increasing group of women in our current cohort, and really what their experiences are, how they've ended up in that situation, and just learning more about their life stories in terms of choices and relationships and things like that.
Sounds like very, very interesting work. And also, as you said, so timely as well, in terms of not necessarily the, I mean, everything is timely, but in particular, I think a lot of people have, in the last year or so, reflected on their life, what they want for their life, if they want to have a family, are they planning to have a family, and what that looks like. And I guess also who else you might need or not want to have in that family structure. So it's that's one of the reasons I'm really excited and interested to hear more about what you have to say on this topic, because I do feel that some of the things we're going to talk about, it needs to be spoken about more in a more natural sense, so that people feel comfortable to have these discussions. I think certain things in particular around, solo motherhood and things like that is still pretty much a taboo topic to some extent. So I'm really looking forward to unpacking that. So what made you decide to focus on working in this area?
That's a really good question, and I'm not entirely sure. I mean, this is quite a new area of sociological focus. And I have some very dear colleagues who sort of work in different aspects of these questions. But I think for me, it was just, I sort of serendipitously fell into it, started looking at these questions. My first sort of research project was about couples going through IVF and how that impacted their relationship as a couple, how it impacted the way they thought about their own bodies, or the way they thought about their gender identity, or sort of their sense of womanhood or manhood. And it's just all grown from there, from one interesting topic to the next. But I just wanted to say, I mean, just picking up on what you said a moment ago about some of these topics still being taboo. And I think even where they're not taboo, they're not necessarily as visible as they ought to be. So I think, the last year has been a very interesting and different and challenging, obviously, time for people. But one of the things we've seen is these differences in our society become more explicit and more visible and more discussed. And one of the things that a lot of the women that I work with really picked up on was the kind of media attitudes around the lockdown, and how it was all about families, and it was all about, both parents working from home, juggling homeschooling, etc., as if the only family type we have in this country are, a mother and a father living with their genetic offspring. And of course, we know statistically, we know from the census, we know from our friends and, the people around us, that that's really not the case anymore. There's so much more variety. There are people who desperately want children and don't have them, or don't have them yet, and they're going through IVF. There are solo mums who are having to shoulder that burden completely on their own. There are all sorts of different, patchwork and rainbow families. So that, the idea, the stereotypical idea that it was a mother and a father working from home with their children was not the reality for many people.
That is so true. And as you said, that the narrative that the media has created over the last year could also contribute to people feeling a little bit maybe down or depressed about their own current situation, because they're not seeing that representation in a broader sense. Could you explain what's patchwork families? Did you say patchwork family? Sorry,
I did.
I've never heard of that term before.
That term is sometimes used to denote families that may have, adults in a household for whom it might be a second marriage or a second or a third union, and children from different sort of marriages or different relationships all living together. So that's sometimes referred to as a patchwork family.
That's really nice. Thank you. I've never heard of it. Thank you for explaining. So we've talked about, you've highlighted sort of the impact of families and the perception last year, and we're going to delve into that a little bit later on. But in general, how has the landscape of reproduction changed over the past generation?
So a short answer is hugely. I really think that if we, you and I are probably of a similar age, if women of our generation are actually facing a completely different set of options, and reproductive choices than our mothers. So if we compare our generation to the generation of our mothers, we've really seen a huge amount of social change in the space of that one generation. So we know, for example, that age of first motherhood is greatly increasing. So in the UK, that's now over 30 for the first time in a long time. We also know that fertility rates are falling. So the birth rates in the UK are at the lowest they've ever been. And we have a completed sort of family size of 1.89, which is lower than replacement rate. These things are trends not just for the UK, they're certainly trends across Europe and even further afield. We're seeing this, the number of children women are having is coming down, and the age at which women are starting to have children is going up. So that's a broad trend we're seeing. Now, in the UK, there are certain other changes. So more children than ever are being born out of wedlock, so in partnerships or to single mothers. We are seeing that more women over 40 than ever before are having babies. And in fact, in the last 30 years, I believe that the number of women over 40 having children has tripled. So that's a really fast growing group, older mothers. And unfortunately, some of the more difficult issues that we're seeing is because women are starting their families later, higher numbers of women are facing involuntary infertility, age-related fertility decline. And actually now, by the time a woman reaches 45, 1 in 5 of those women will be childless. Of course, some proportion of those people will be childless or child-free because they've chosen that for their life, and that's great if it's a choice. But some proportion of that number will be because they haven't been able to have the families they wanted to have, either because they haven't been in the right relationship or because they've faced fertility issues, etc. So a lot of different changes in the space of one generation.
Oh, I just had to
and
sit
also,
back.
of course, much more. IVF was the first successful IVF baby was born in 1978, Louise Brown. So that's 43 years ago now. And we're now in a world where it's incredibly common. But now what I wanted to say is that the first IVF baby was born in 1978, 43 years ago. And now we're living in a world where everybody knows somebody who has had IVF. And on the one hand, that's great, because it means people who might not otherwise would have been able to conceive children are able to do so. But on the other hand, it also kind of reflects that maybe we're living in a time where there is increased need for fertility treatment.
Yes, there was a lot of what you said, and I was listening. I was like, oh, okay. It's interesting because it feels as though society has moved in a certain way where people are establishing the careers. I'm not saying all of this, and please, as you know, not an expert at all. This is why you're here. But a lot of conversation. People often say, "Oh, because women are able to, study and build their careers, and so therefore, I guess to some extent, putting all the I don't want to say all the blame, but some level of blame to women wanting to get their careers and then establish their families, quote unquote, later." But I do find that narrative just interesting, where people are making choices in their lives that mean that they're having children later. But it seems like our biology hasn't caught up with that trend. It seems as if things are advancing in so many ways. And I remember a time when my cousins were born, and we used to sit and wait for their eyes to open, and now babies are born eyes open, looking around. But yet when it comes to reproduction and how our bodies work, it's stayed exactly the same. Am I sort of making some level of sense there?
Yeah, no, absolutely. So although we're seeing socially that for many people it might make sense from a social point of view to have children later in life. So for example, when you've finished your higher education and training, when you have some economic stability and a job, when you've settled down into a stable relationship, when you've bought a house, whatever those social circumstances that are appropriate might be, of course our biology has stayed exactly the same as it's ever been. And biologically, women are really at their most fertile, during their 20s, and by the time we reach our 30s, age-related fertility decline has already started to take hold. But also, even though, like you say, in the media, when these questions get discussed, it's always presented as if people are having children later in life because this is a choice that women are making. And while to some extent, of course, women are now able to participate in the labor market, and they have much greater educational opportunities. And of course, it's very natural that lots of women will want to take advantage of that. In many cases, it's not a choice. When we talk about later motherhood over 40, for example, in most cases, that's not been a choice. In most cases, women will say that they were actually ready to have children quite a while ago, but they just weren't in the right relationship, or their partners weren't ready, or they were in a very serious relationship and they thought they were going to have children in that relationship, and then the relationship broke up. So you're then sort of starting from scratch and dating. So it's a mixture of factors. And we also absolutely have to think about men's preferences. So if women want to have children later, I think that's even more true of men, who are also postponing the age of fatherhood.
Very, very true. Lots to unpack. So going to keep us focused, because I'm keeping myself focused actually more than anything. I'm like, let me not sit and ask you all the questions I have in my mind. So we're going to today, we're going to talk about single women's fertility options, egg freezing, motherhood after 40, reproductive anxiety, which I'm very, very interested about because I didn't know about this term. And then we're going to talk about miscarriage. This is based off an article that you wrote in The Guardian a few months ago. So let's start off with single women's fertility, very big topic, which I'd really like to unpack. So why does this area require such attention? Why is this area important?
So as we were talking about all of those changes that are occurring in society, one of the biggest changes we're seeing is that more and more women are entering parenthood as solo mothers, using donor sperm either through clinics or somehow arranging donor sperm arrangements outside of clinics, or choosing to co-parent with somebody that they're not romantically involved with. And it's really interesting that we're seeing this increase, because on the one hand, this tells us something about the changing nature of families and the changing nature of relationships. And what women say to me most often when I ask them how why they're thinking about pursuing solo motherhood, or how they've ended up pursuing solo motherhood, it really goes back to that question of relationships and not being in the right relationship, feeling that they don't have the time to wait to meet Mr. Right, and really wanting to take some control, some agency over their reproduction. And this idea of decoupling reproduction from romantic dating or intimate relationships. So a lot of these women will be in their late 30s. And the reasoning, they might reason by saying, rather than missing out on motherhood because I'm waiting for this right person who may or may not come along soon, I'm going to take charge, have a baby now, and then hope to meet somebody later, or perhaps, be happy on my own or whatever. So it's a pretty new and interesting development.
As you were explaining that, I had a bit of a random segue and correlation. Angelina Jolie did something very similar. She was single, she adopted her son, and at the time, many years ago, it seemed so radical. It was like, what is she doing? And it's funny how you look back and you're like, oh, there were people who were doing these things, and now you're looking, oh, actually, maybe there are some examples that one can draw. And I mean, it was a very random segue, I know.
No, definitely.
Yeah. And so, oh, sorry, you can say.
No, I think you're right. And, with all of these things, there have been women who are pioneering these kinds of family forms for quite a while. What's interesting now, I guess, is that it's becoming increasingly common. So I think whereas maybe 5-6 years ago, most people would not have had a friend who was doing this on their own. I think nowadays, most people probably know someone, even if it's not a close friend, they have a friend of a friend who they know has gone down this route. And what's really interesting is when I speak to these women, there's a little bit of a sense that life hasn't quite gone according to plan. So a lot of women who I speak to in their late 30s who want to become mothers but aren't yet, they'll say, I just really didn't expect this to happen. By this point, I thought I would be married. I thought I'd already have some children. A lot of my friends are married and they already have their children, etc. And sort of they feel this sense of slight isolation, or why me, or what did I do wrong, or what decisions did I make that have led me down this path. And I think what's important about taking this sociological perspective is we can say it's not just about you and the decisions you made in your life. This is a broad social trend we're seeing. And while you might be the only person in your small friendship group to be doing this, actually we know that increasing numbers of women across the country and across the Western world are doing this.
And that's really important. So people don't feel isolated in their choices and know that there are other people, and maybe make them feel part of something as well, so they know that there are other people that are out there and their sort of resources as well. And so what are the options for single women who would like to have children but don't currently have a partner?
Yeah, so there are a couple of options. One of them is called DI, or donor insemination. And that's really a fairly simple process by which a sample of donor sperm will be inserted through the vagina, through the cervix, into the uterus, at the right time of the month, so that conception might occur. And many women who don't have any reason to feel that they have underlying fertility issues would be likely to go for donor insemination if that's, if they just want to conceive a baby using donor sperm. It's also possible to have IVF using donor sperm. IVF as a process is slightly more involved, more invasive. It requires, several weeks of taking drugs to induce ovulation, and then a process of egg collection. And then those eggs would be fertilized in a lab using donor sperm. So those are really the main options within a clinical setting. Outside clinics, of course, there are people also making kind of at home DIY arrangements with people that they might want to co-parent with. And there are, I think there are pros and cons to that. Of course, within a clinical setting, there are certain guarantees in terms of health and well-being and legality, which don't hold if you're kind of doing this outside of a clinic. But some people nevertheless opt to do that for personal preferences and sometimes reasons of cost. So those are kind of routes into solo motherhood. There are other women who are feeling concerned about age-related fertility decline, but don't feel that they want to become a mother right now, or don't feel they'd like to embark on solo motherhood. So an option for those women would be to freeze their eggs, which of course is not a guarantee, but it is a technology, a fairly new technology we have to hand, that increases a woman's likelihood of being able to conceive with eggs that she banked or froze when she was a bit younger.
Very interesting. I know when you were talking about the options outside of the clinic, I know that there have been some documentaries, not last year, but I think 2019, with people who were using quote, illegal donors and men who would, I don't even know how to word it, but deposit their specimen in the car and then drop it off. And it was, yeah. But again, it's just thinking, and I guess in all seriousness, whilst from a documentary perspective that could be interesting, but all that those documentaries that I've seen have focused on have been this is something quote unquote weird that people are doing, but they don't talk about the why. Like, why might somebody want to look at that as an option for having a baby? They just more focused on these men in their cars doing whatever. And it's just, I think I'm having my sort of awakening moment, just realizing how certain narratives are put forward, because perhaps in a documentary like that, it would have probably been good to have a more rounded overview of maybe why people may look at sperm donors, and talk a little bit more about this is a growing trend, as you said, like something that's happening, and give some context. But I was just remembering that, and we're going to talk about egg freezing. In fact, let's talk about egg freezing now. So I guess could you elaborate a little bit on egg freezing, and how does it work, and what are the quote unquote best options? Because as you highlighted, it is still relatively new, isn't it, as a method? but it's something that you hear people say, oh, you should consider egg freezing, or egg freezing, but we don't really know. I don't think the knowledge is really there in a sort of conversational sense. So yeah, please, just anything, educate us.
So egg freezing, as you say, it's fairly new technology. It's only since 2012 that the European Society of Human Reproduction and Embryology has kind of given the go-ahead for egg freezing to be used in an elective manner. Before that,
in 2012.
Yeah. I mean, there was some egg freezing before that date.
Yes.
But it was only in the case of where it was necessary for medical reasons. So women undergoing cancer treatment who were going to lose their fertility, etc. And there would have been a few kind of pioneering women who may have frozen their eggs for what we call elective reasons. So not an underlying health condition, but just because they're worried about their age. So there were a few, not very high numbers, really very small numbers of women who'd done that. But the go-ahead, the European go-ahead, came about in 2012. And the reason for that is, of course, because it was a new technology, the success rates are not very high, but they're getting better. And now eggs are frozen using this technique called vitrification, which is a method of fast freezing eggs so they have more likelihood of being able to survive, which is more complicated with something like an egg cell than a sperm cell, which is, why sperm freezing and sperm banks have been around for decades, because sperm cells are very small and they're much easier to freeze. And the technology is getting better in terms of the freezing of eggs. In the UK, we have the Human Fertilization and Embryology Authority, which is the regulatory body that looks after all kinds of fertility treatment. And we know from the national statistics that they have that egg freezing is by far the fastest growing fertility treatment. So, it's kind of doubled and quadrupled and gone up several 100% in the last 5-6 years. But overall, it still doesn't account for a huge number of cycles in the UK. So we're talking about, several thousand women opting for egg freezing. In terms of what the process looks like, it's very similar to, it's basically just the first half of an IVF cycle. So you would go through a couple of weeks of hormone injections in order to try and make your ovaries grow, not the one egg we would get in a regular month, but multiple numbers of eggs. And then there's a surgical procedure to collect the eggs. And then those eggs are immediately frozen using this vitrification technology. And if a woman freezes her eggs and would like to at some point in the future come back and use them, then what happens is those eggs are thawed. They're fertilized using sperm from a partner or a donor sperm, and then they're put back into the uterus of the woman. So effectively, it's like she's going through an IVF cycle, but with the eggs that she banked, at age 38 instead of at age 42 when she's using them, for example.
Very, very interesting. And I guess the question, because the narrative that's often what I hear is, oh, it's the earlier the better to freeze your eggs. It's better to do it as soon as possible. So is there like a best age, optimal age? What would you say, is there any data on that?
Yeah, I mean, there's a little bit of debate on that. So medically speaking, or, biologically speaking, we know that the younger women in general, and, all of our fertility declines at a slightly different and individual rate. But we know in general that when you're younger, you have better fertility. As you get older, your fertility starts to decline. So even by the time a woman is 30, her fertility is declining. By the time she's reached 35, it started to decline a bit more rapidly. So if we were talking purely in biological terms, you would say, well, it would be great if somebody was 30 and they froze their eggs. And this is what a lot of clinicians or reproductive specialists might say. As a sociologist, I have a slightly different perspective, which is that, at age 30, most women don't need to feel anxious. They'll be fine. Most, even though I think we are living in this world where we're all feeling quite worried about all aspects of our lives. Well, if most women froze their eggs at 30, what we would see would be that the huge majority of those women went on to conceive naturally with no problems whatsoever, having undergone a technology that wasn't really necessary for them. So I guess you kind of have to weigh that up. I think, mid 30s is a good time to freeze your eggs. Your eggs are still likely to be quite good quality, and therefore, give you reasonable success rates. And you're going to give yourself, some extra time.
That's
Yeah.
that's very reassuring. It's good to hear that, because as I said before, you get so many different waves of information. Do it now, do it later. And so, because from my understanding, there's a 10-year limit for freezing eggs, but there have been talks about extending that. So I mean, are there any possible negative side effects for storing the eggs later? Is it necessary, I guess, as well? Is that 10-year period even too long as it stands?
Yeah, that 10-year storage limit in the UK is a really important consideration. And that links to the question you just asked about, at what age to freeze your eggs. If you were 30 when you froze your eggs and you have to discard them by the time you're 40, just when you start to need them, that seems, pretty useless. So again, that's a really important consideration to have in mind. In terms of the technology, there's no reason why eggs should be stored for 10 years as opposed to 15, as opposed to 20. Once they're in that frozen state, they don't degenerate. So the 10-year limit was not set in place because sort of technologically they expired after a certain date or whatever. It's a really arbitrary social rule, which is precisely why, like you've said, there have been lots of campaigns in the UK to try to extend that, because what we're seeing now is those very early pioneers of egg freezing, those women who froze their eggs, some of them are coming towards the end of their 10-year limit, and some of them have not used their eggs. And really the last thing they want is to have to, discard or throw away these precious eggs that they've had in storage. And there doesn't seem to be any reasonable justification for why they need to be forced to do that.
Very interesting. Yeah, very interesting debate. So it'll be interesting to see how things progress in that area. So I recently heard of the term social egg freezing. What is it, and how does it differ from medical egg freezing?
Yeah, so that goes back to the issue we were mentioning earlier. So medical egg freezing is really when a woman's fertility is under threat for reasons of, illness or treatment, like chemotherapy or something like that. So then her eggs will be frozen for quote unquote medical reasons. Social egg freezing was a term used to denote anybody who froze their reasons for their eggs for other reasons, like being concerned about age-related fertility decline. Some people feel that's a bit of a derogatory term, which is why it's more common now to use the phrase elective egg freezing. And some people argue, the social medical distinction doesn't really make sense. So elective is planned egg freezing.
Yeah, so because when you explained that, I was like, yeah, social to me does seem a bit derogatory, actually. It's not but then unless because I'm thinking socializing, sort of frivolity type thing, but unless they're thinking social as in sociology, that's the reason, progress. I don't know if that's what they're thinking.
Yeah, I think for many people it has the former connotations you mentioned, that the idea of, oh, I'm freezing my eggs because I'm too busy,
Fun.
or
Yeah,
because I want
to go out.
Yeah. And that's not what women say.
No.
They're doing it for quite a serious reason, and because they're being conscientious, because they want to give themselves the best opportunity to become a mum. So to reduce that to something that's just kind of a social decision just perhaps doesn't seem quite right.
Not at all. And I think from especially just listening to what you're saying and trying to delve deeper, and as I said, making sure I'm keeping the focus of what I want to talk about, because there are many things. Might have to have you come back. But I can understand that a woman who is thinking about freezing their eggs, what are you going to do if you're single, if you're in a relationship? It will actually make a woman very vulnerable to just being drawn in to any form of information, and this leads on to issues around misleading and advertising or advertisement, sorry, for egg freezing. Because as I'm listening to you, thoroughly enjoying it, but I'm thinking about so many different things. I'm like, okay, so you've got to, if a woman is in this situation, she's got to think about this, so where, like, what's the data, what's the information around, not even so much we'll talk about the vulnerability of the woman in this situation, but how as advertising, what's going on in that area, misleading advertisement, sorry, on egg freezing, and just what's going on there, and how is that policed or regulated?
Yeah, again, the short answer is that it's not really regulated. So egg freezing is the only form of fertility treatment in the UK that only takes place in the private sector, elective egg freezing. So again, this medical egg freezing you can get on the NHS if you're going through treatment, etc. But if you're a woman who's concerned about her age, or you're not in the right relationship, or you've just come out of a relationship, and you feel concerned and you want to freeze some of your eggs to give yourself a better chance of having a child later in life, the only way to do that is through a private clinic. So when I speak with women and I ask them what they do, how do they find out about it, of course I think obviously what most people do is you just go on Google and you Google egg freezing London, or egg freezing wherever you are. And if you do that, most of the top hits that come up, most of the hits on the first page will be the websites of fertility clinics. And, we think about fertility clinics as a medical place. We think that, that would be maybe really accurate information. But we did a research project looking at how fertility clinics marketed egg freezing on their websites. And unfortunately, we found that there was a lot of misleading information and a lot of biased information. So where the benefits of egg freezing were discussed, and none of the potential disadvantages or potential risks were not really discussed. And also, we felt that some of those websites gave a misleading impression in terms of how successful egg freezing can be. So again, if anybody is interested in egg freezing, the best place to go to for information is the Human Fertilization and Embryology website. And they actually published a paper for sort of like a report for women considering egg freezing, which is called, Is Egg Freezing Right for Me?, which has national data about success rates. And really the success rates of egg freezing is about 1 in 5. So for every woman who successfully becomes a mother using her frozen eggs, 4 women don't. And I think that's really important to know, so that women don't freeze their eggs and then go away and think that they've got a guarantee, or, this term that's always used, an insurance policy. Well, if you had an insurance policy on your house, but it only paid 1 out of 5 times, we wouldn't think of that as a very good insurance policy. So I think we definitely need much more transparency. Not to say that the technology is bad. I mean, obviously this technology is groundbreaking and it has been very useful for some women, but it's really important that women make decisions understanding, the transparent and clear information about the issue.
Yeah, this is really, it's again just so interesting, because this is actually the first time I've heard of the realities of egg freezing, because the narrative has been the insurance policy. Oh, once you're ready to use the eggs, it's going to be fine, everything will work. But sometimes we need those facts and figures, and as you said, it's not necessarily because there's something wrong with the science, it's just how it is. It's just the nature of the process.
I mean, the success rates for IVF, do you have any idea what success rates for IVF are?
Can I say 100%? Do I get my mark? Like 100%?
I wish. I really wish it was 100%. It's between 25 and 30%. So IVF, which is a technology that's been around for a long time, a lot of people undergo IVF. So in terms of treatment cycles, for every 1 cycle that ends with somebody getting pregnant and having a baby, there are 2 other cycles where that doesn't happen. And this is why many people will go through multiple cycles of IVF and end up having babies. But egg freezing is of course more complicated than IVF. So even though those success rates might increase in the coming years, and we would expect them to increase a bit because the data we have now is, from people who froze their eggs maybe 5 years ago, etc. So while we would expect that figure to increase, I don't think, we wouldn't expect it to ever increase beyond the levels of IVF. So even, best case scenario, we're looking at, 30% success rates. So it's really important to keep that in mind.
No, it really is. And actually with IVF in particular, I know people feel that the first round is what they're hoping. Oh, okay, it'll just be 1 round. They don't realize that, I remember times when I've just worked in a pharmacy, and same patient coming back again to get their prescription, and you're like, oh, any luck, and they're like, oh no, another round. It's like, okay, and it's expensive as well if you're not doing it privately.
Definitely.
And
like there are many things in life where we're used to trying multiple times in order to manage it. So just to say, oh well, many people might need to have IVF multiple times in order to get pregnant, that doesn't sound like so much, but actually emotionally it's a really difficult process, and it might be a process that's filled with dashing of hopes and even potentially reproductive loss, like getting pregnant and then losing a baby. So to go through multiple cycles of IVF, it sounds like such an easy thing to say, but that can be an incredibly difficult thing for some people.
Thanks for joining us this week on the Monday Science podcast. Make sure to visit our website. Details are in the episode description, where you can subscribe to make sure that you never miss the show. So catch up with you next week. Bye.